The contrast and CT scan of a 78 years old female. She was operated upon for cholecystectomy and simultaneously anterior abdominal wall hernia repair about 1 week ago. Now she is a known case of hepatitis C, and now she has presented with the signs and symptoms of acute peritonitis. Now please observe small pleural vein on left side. There is distal ectasis of adjacent lung. Let me show you. Now similar atelectatic bands are present in the posterior basal segment of right lower lobe. Now please observe the cirrhotic morphology of liver. Its outline is wavy. As such, there is no focal hepatic lane apart from the cirrhotic changes. Now, please observe that patient has developed multiple abscesses. Now, this is the small abscess here. First, I will trace its anterior component, extends downwards along the anterior margin of right lobe of liver. It comes up to this level. I go back again. Please observe its thin marginal enhancement. Now it goes upwards. Almost up to the level of porta hepatis. Now this. And then it courses downwards. This one here, and reaches up to the lateral surface of second part of duodenum. Now please observe the enhancement of parietal peritoneum. Infective etiology. This is another abscess here. This one here. Parietal peritoneum is thickened and shows significant enhancement. There is mild ascites. Now this ascitic fluid in fact is extending outwards through the defect in the anterior abdominal wall and is the source of fluid coming out of the anterior abdominal wound. Similar diffuse ill-defined fluid tension areas are noted in the right lower lateral anterior abdominal wall along with the inflammatory straining of the subcutaneous fat. So there is an element of peritonitis and multiple intra-abdominal postoperative abscesses along with the pleural vein on left side and distal ectasis of adjacent lung in the posterior basal segments of both lower lobes. This again is the small amount of ascitic fluid here. Patient has got cirrhotic morphology, but as such there are no significant signs of portal hypertension. Spleen, although prominent, but no significant dilated blood vessels along the curvatures of stomach.